Hello, my people. I'm back. This is part 3 of our labor process. Okay, so um, what should be expected of me? What is expected of me as a laboring woman when I'm laboring, and what's expected of the midwife also? So let me start from our point first. Okay, so with us, for if you are in the latent phase of labor, that is from the tip dilation to the 3 cm, we are supposed to monitor your baby's heart rate every hour. It's so funny that sometimes you monitor the heart rate, and you will leave, and within the next 30 minutes the baby would have tied him or herself with the cord, especially when the cord is very long, tied him or herself with the cord and just strangle himself in utero. The next moment you come, the baby is gone. And sometimes we are blamed for negligence, but sometimes it's not us. Okay, you cannot really explain, because you check the heart rate is there. In the next 1 hour you may come and the heart rate may not be there. Maybe within 30 minutes the baby may have tied himself with a cord and strangled himself. Do you understand? So every hour we are supposed to do this for you. So when the midwife is coming to you to check the heart rate of your baby, please don't turn us away. We beg you. We know it's uncomfortable, but we have to do this. Do you understand? Then also, what is expected of the midwife? The midwife has to check your temperature and your pulse and your respiration every 4 hours. Okay, so this is done for you. Then, as and when you are in pain, this is for the latent phase. Okay, so if you are showing a progression of the pain, then your midwife will come and assess you again to see if you have progressed into the active phase. But if you are lying down without showing any pain, we come and check the contractions every hour too. We have to come and check the contractions in the latent phase. If we do that and we see that some people, the contractions will cease, for others it will progress. Okay, we are all different. If we see that the contractions have ceased, we wouldn't want to bother you so much. We just want to check your vital signs and that of the baby for you. Okay, so that is in the latent phase of labor. Then we advise that if the waters have broken, you lie down for us to take care of you. If the waters break 12 hours before labor is established, you have to be put on antibiotics. That one, it will be done for you at the hospital, so don't worry about it. Then for you, in the first stage of labor, I've told you that in the latent phase, please eat your heavy food. In the active phase, eat your light meals. Then you should make sure that you have to empty your bladder. That means you have to urinate often. Okay, how often? At least every hour you can pass urine. If you don't get anything at all, at least 30 mils of urine in an hour is okay. Okay, then drink lots and lots of water. You need to stay hydrated. Okay, going forward, your midwives will restrict you and put some infusions on you, but you need to stay hydrated yourself. Okay, then also you need to gain energy, so you need to eat the light meals that will be prepared for you, your Milo, your washke, whatever. You need energy. Do you understand? Then also your personal hygiene, please keep it top notch. So the pad, you may have your pad being soaked with the Lycol, or you may have it with the show and the blood streaks in it. So as and when the pad is soiled, you fold it into a neat black polythene bag, then you keep it by your side. Okay, then you wash your hands, because you don't want to contaminate yourself. Then once you are in the active phase from 4 centimeters, it's assumed that from the active phase, every hour you are supposed to dilate 1 centimeter. Although we are different, some people may not follow that 1 centimeter rule. They may follow, for some people, every hour they may or every 2 hours, 3 hours, they may dilate to 1 centimeter. That one is for us. We will decide on what to do for the client. Do you understand? So well, the normal one from 4 centimeters, every hour you are supposed to what, dilate 1 centimeter. So if you are in the active phase of labor, your midwife has to do a vaginal examination every 4 hours to determine how well your cervix has dilated. We just put in our 2 fingers. We don't put in all, as some people say out there. No, it's just our 2 fingers, and we open it as and when. Okay, so we want to open it to see how many dilatation you have gotten to. So if it's 5 centimeters, 6 centimeters, 7 centimeters, 8 centimeters, 9, 10, we open it to see how you have gotten to. We don't just want to see the how well the cervix has opened. We want to see where the baby is coming with. Okay, whether it's with the back of the head, it's with the face, it's with the buttocks, the hands, whatever it is. We also do that assessment to check all those places to know the kind of treatment to give you. Then also you can shout. We all have what, our threshold, our pain threshold. But what we advise is that whether you shout or not, pain na pain. You understand? Whether you shout or not, you will still be in pain. What we advise is that you minimize your screaming to conserve energy. Okay, because we are going to use the energy in the second stage room. If you shout so much and exhaust all your energy in the first stage room, you may be exhausted and you cannot be able to push when it's time for you to go and push in the second stage room. Do you understand? So what can be done to minimize the shouting? We encourage that our partners, any partner you trust, if it is your husband, you let him be there for you. If it is your sister-in-law, your brother-in-law, whoever, if you want a man who is not your husband to come and watch you, so long as they are not, in the Ghanaian setting, our setting is not so good, but where we have partitions, we keep you inside there. Okay, if it is a man and a woman, we keep you inside there so that you not look at other people. Okay, we want privacy. Okay, so where there are a lot of women and the hospital do not have those kind of partitions, we still need to work on our health system. Okay, so where the hospital does not have those partitions, the men are not really allowed to come in, but where they have the partitions, the men will come in and be with their partners. Then you can be given a sacral massage. Your lower back can be massaged. It helps to relieve pain. Your feet can be massaged, which also helps to relieve pain. Then you can do breathing exercises. Okay, you breathe in, then out, in, then out. It also helps to relieve the tension. You take in more oxygen. It helps you to relax and all that. Okay, all these are ways of these are diversional therapy that will take your mind off the pain that you are going through. Others would also want to watch a movie. Others would want to watch pictures of babies. Whatever relieves your pain, please go in for it. If you are in a hospital that can give epidurals, you request for it. Okay, so Korle Bu does it. 37 Military Hospital does it. Bank Hospital also does it. So if you want epidurals, you can go in there and it will be done for you. Okay, so the first stage of labor, these are the do's and don'ts in the first stage of labor. When you get to the transitional phase and you want to pull, your midwife will ask you to pull on yourself. Your midwife will come and clear it for you, because when we allow you to go to the washroom, the chances are that you can pull your baby inside the washroom. That is why your midwife will not allow you to go to the washroom to pull. So this is the first stage of labor. Now you are 10 centimeters dilated. you can't feel any cervix around your baby, let us go to the second stage room and bring our baby out. Catch you.